Welcome back to Patriot Power Products Trusted Guides and Reviews, where everyone's favorite hosts, Jim and Ann, talk about essential information you can use right now, and the best products and the best discounts available online and elsewhere, for patriots following the American way.
All right, so you're ready to build a medical kit that's way more than just a couple Band-Aids.
Definitely.
And we are totally here to help you do it.
We are.
We've actually written this really comprehensive guide.
Yes, we have.
And in this deep dive, we're going to break it all down for you.
We are.
Sharing some of those hidden gems and expert tips to create a kit you can totally rely on.
Yeah.
It's not just about having the supplies, though.
No.
It's about really understanding why they matter.
Yeah.
How to use them.
How to use them, for sure.
If effective.
And that's one of the key things that we really emphasize in the guide.
Oh, yeah.
Is that there are levels to emergency medical supplies.
Levels.
Just like in a video game.
Okay.
And understanding these levels really helps you prioritize.
Okay.
And build your kit strategically.
Okay. I'm all ears.
All right.
Break it down for me.
All right, so picture this.
Okay.
Level 1 is for those heart-stopping emergencies where every second counts. Think major bleeding or a blocked airway. It's about having those absolutely crucial tools right at hand to stabilize the situation before professional help can arrive.
So it's like the grab-and-go kit.
Yes.
For those worst-case scenarios.
Precisely.
Okay, got it.
Now, level 2 is where we step back just a little bit.
Okay.
It's for those everyday injuries and ailments.
Okay.
You're much more likely to encounter cuts, sprains, fevers. Think of it as your home base kit for managing common health issues.
Makes sense. So that's like the everyday stuff I'm going to grab for a scraped knee or a headache.
Got it. But level 3 is where we really think about those extended care scenarios.
Okay.
Imagine a natural disaster, a power outage, even a multi-day wilderness trip where access to medical care is limited.
Limited, yeah.
This level includes supplies that help you bridge that gap.
Right.
Manage more complex situations. Provide care for a longer period.
Wow. Okay, so that level's approach makes the whole thing so much less daunting.
Right.
It's like building a foundation.
Yeah.
And then I'm just adding layers on as needed.
Yeah, precisely.
Yeah.
And it helps you prioritize.
Okay.
Because if we connect this back to you and your needs, you are statistically much more likely to face a sprained ankle on a hike.
Right.
Than you are a major traumatic injury.
True.
So having a solid level 1 and level 2 foundation is really crucial before we venture into that more specialized realm of level 3.
Makes sense.
Okay.
So let's start with level 1.
All right.
Those immediate life-saving interventions.
Okay.
What are those must-haves that can make a real difference in those critical moments?
Without a doubt, bleeding control is paramount.
Right.
That's why a tourniquet is an absolute must-have.
I'll be honest. I've always been a little intimidated by tourniquets.
I understand.
They always seem like something only a medical professional should handle.
Right.
I don't want to mess that up.
Yeah, I understand that feeling.
Yeah.
But here's where it gets really interesting.
Okay.
Modern tourniquets are designed to be user-friendly.
Okay.
Incredibly effective, and with a bit of practice, anyone can learn to apply one correctly.
Oh, okay.
In fact, we recommend watching a few training videos.
Okay.
They're readily available online.
Oh, good.
And they can make all the difference in an emergency.
So you're saying I shouldn't shy away from including one in my kit?
Absolutely not.
Okay.
It's one of those things that you hope you never need.
Right.
But if you do, it can be life-saving.
Right.
Kind of like having a fire extinguisher.
Yeah.
You'd rather have it and not need it than the other way around.
100%.
And the same goes for hemostatic agents.
Okay.
These are like clotting accelerators. They help to stop bleeding quickly.
Okay.
They come in a variety of forms, like impregnated gauze or granules that you apply directly to a wound.
Okay, so we've got tourniquets, hemostatic agents.
Check.
What else is in that level 1 life-saving umbrella?
Pressure dressings are crucial as well.
Okay.
Think of them as super-powered bandages.
Okay.
Designed to apply direct pressure to a wound.
Okay.
To further aid in bleeding control.
Like those Israeli bandages I've heard about.
Exactly.
Right.
An Israeli bandage is a great example of a pressure dressing. Incredibly effective.
Okay.
And the self-applying design means you can use it on yourself even if you're the one that's injured.
That's fantastic.
It is?
So we've got bleeding control covered.
Yes.
Now, what about airway management?
Okay.
So say someone's unconscious and not breathing. What do we need?
In that situation, a CPR mask is essential.
Okay.
Not only does it provide a barrier for safe rescue breaths, but many of them come with a one-way valve. That helps prevent the spread of infection.
Okay.
So it's about protecting both yourself
Right.
and the person you're helping.
That makes a lot of sense. I never really considered the infection aspect of it.
Yeah, it's crucial.
Yeah.
Especially in those emergency situations
Right.
where you might not know the person's medical history.
Of course. Yeah.
Now, in addition to the CPR mask,
Hmm?
consider including oral and nasopharyngeal airways in your kit.
Okay.
Think of these as simple tools that help keep the airway open
Okay.
if someone's unconscious.
So those help to maintain an open airway.
Yes,
But are there situations where you might actually need to, like, clear the airway?
absolutely.
Hmm.
That's why we recommend adding a suction device to your level 1 kit.
To the level 1 kit, okay.
You never know when you might need to quickly clear an airway
Right.
of vomit, blood, or other obstructions.
Wow. I'm starting to see just how comprehensive this level 1 kit needs to be.
Yeah.
It's really about addressing those immediate, potentially life-threatening situations.
Right.
And having the right tools and understanding how to use them
Mm-hmm.
can truly empower you to act effectively in those crucial moments.
Absolutely.
Yeah.
Okay, so let's shift gears a little bit.
Okay.
To level 2.
All right.
The supplies for those more common injuries and ailments.
Yeah.
We're stepping out of that life or death zone
Right.
into the realm of everyday bumps and bruises.
Exactly.
Now, wound care takes center stage here,
Yes, it does.
but it's not about slapping on any old bandage.
No, it's not.
You really want a variety of types and sizes to match the specific injury.
You do.
So not all bandages are created equal.
Definitely not.
Really?
Think about it.
Okay.
You wouldn't use the same bandage for a paper cut as you would for a deep gash, right?
True.
Each type of bandage has its own strengths and weaknesses.
Okay, so what kind of variety are we talking about here?
Let's start with the workhorse of wound care.
Okay.
Adhesive bandages.
Okay.
You'll want a good mix of sizes,
Yeah.
from small ones for those pesky fingertip cuts
Oh, yeah.
to larger ones for covering scrapes on elbows or knees.
I'm guessing knuckle bandages are a must-have if you have active kids.
Absolutely.
Yeah, those pre-shaped bandages seem like a lifesaver for those awkward spots.
They are.
Yeah.
They're designed to fit snugly over knuckles and joints,
Yeah,
allowing for greater flexibility and comfort.
that makes sense.
And speaking of specialized bandages,
Yeah.
don't forget butterfly closures.
Those little sticky strips.
Yeah,
They always seemed a little flimsy to me.
I know they do.
Why are they so important?
They're actually incredibly effective
Okay.
for closing small wounds that might gape open.
Okay.
They gently pull the edges of the cut together,
Okay.
promoting faster healing and minimizing scarring.
So they're like mini DIY stitches?
In a way, yes.
Right.
They're not a replacement for actual stitches
Right.
if you have a deep or serious wound.
Right.
But for those minor cuts,
Okay.
they can make a big difference in how the wound heals.
Okay, I'm seeing the value of butterfly closures now.
So we've got adhesive bandages,
Yep.
knuckle bandages,
Mm-hmm.
butterfly closures.
Yeah.
What else is essential for wound care?
Gauze pads and dressings are a must.
Okay.
You'll want sterile gauze pads in various sizes.
Okay.
2 by 2 inches and 4 by 4 inches are the most common.
Okay.
They're perfect for cleaning and covering wounds.
I usually just grab whatever gauze pads are on sale.
Okay.
What's the difference between regular gauze
Okay.
and those non-stick dressings?
Ah, great question.
Yeah.
Non-stick dressings are a game changer,
Okay.
especially when it comes to changing bandages.
Okay.
As the name suggests, they don't stick to the wound.
Okay.
So you don't have to worry about ripping off a scab
Oh, that's good.
or causing more pain when you remove it.
That makes a lot of sense, especially for kids
Yes,
who tend to freak out when you're trying to peel off a bandage.
absolutely.
Yeah.
They make the whole process a lot less traumatic
Yeah.
for everyone involved.
Yeah, for sure.
And don't forget about roll gauze. It's incredibly versatile.
All right.
You can use it to secure dressings,
Mhm.
create custom bandages for awkward areas,
Okay.
or even fashion a sling in a pinch.
Wow. Okay. Gauze pads,
Yep.
non-stick dressings,
Mm-hmm.
roll gauze.
Check.
Okay, what about tapes and wraps?
Okay.
I always get confused about which ones to get.
All right, let's break it down.
Okay.
Medical tape is your all-purpose workhorse for securing bandages and dressings.
Okay.
Think of it as the duct tape of the medical world.
Okay.
Athletic tape, on the other hand,
Mm-hmm.
is specifically designed for supporting sprains and strains,
Okay.
providing that extra stability and compression.
Okay.
And then you have elastic bandages,
Okay.
which are great for providing compression and support to injured joints,
Okay.
helping to reduce swelling and promote healing.
So are you saying I need all three?
It's best to have a variety on hand
Okay.
because they each serve a different purpose.
Okay.
And don't forget about Coben's self-adherent wrap.
Coben wrap.
This stuff is truly magical.
Okay, tell me more.
Imagine a wrap that sticks to itself,
Okay.
but not to your skin or hair.
Oh, wow.
It's fantastic for securing bandages,
Okay.
especially on fingers or toes.
Okay.
And its waterproof nature means you can even use it in the shower.
Oh, that's cool.
It is.
Okay, so we've got bandages, gauze,
Yeah.
tapes, and wraps.
Yeah.
Okay, what about cleaning and antiseptic solutions?
You'll want povidone iodine solution,
Oh.
which is great for disinfecting wounds.
Wait, what's the difference between povidone iodine and hydrogen peroxide?
Okay.
I thought they were basically the same thing.
They're both antiseptics,
Okay.
but povidone iodine is generally gentler on the skin
Okay.
and is highly effective at killing bacteria.
Okay.
Hydrogen peroxide, while good for cleaning out dirt and debris,
Okay.
can actually damage healthy tissue
Oh, no.
and delay healing.
So povidone iodine is the better choice.
Generally, yes.
Okay.
You'll also want some saline solution on hand
Okay.
for rinsing wounds and eyes. It's gentle and won't sting.
Got it.
And alcohol prep pads
Okay.
are great for cleaning surfaces and sterilizing tools before use.
Okay, so cleaning supplies, we've got that.
Check.
What about those antibiotic products?
Yeah. Okay.
I always have a tube of triple antibiotic ointment, but
Yeah.
is that enough?
Triple antibiotic ointment is a great first line of defense
Okay.
for preventing infection in minor wounds.
Okay.
But we also recommend including bacitracin packets,
Okay.
especially if you're building a smaller portable kit.
Right.
They're single use,
Yep.
making them perfect for throwing in a backpack or purse.
That's a good point. Yeah, portability is key.
It is.
What about for those more serious infections?
Oh, okay.
Do we need something stronger?
For those situations, you would need a prescription antibiotic cream.
Okay.
But remember,
Yeah.
it's always best to consult with a healthcare professional
Right.
before using any medication,
Right.
especially prescription ones.
Good advice.
Yep.
Okay, so we've got our wound care arsenal all stocked up.
Right.
Now, what about those essential little tools
Okay.
that often get overlooked?
Yes.
Yeah.
Don't underestimate the power of simple instruments.
Okay.
Trauma shears are a prime example.
Trauma shears.
Yes.
So regular scissors aren't good enough.
Regular scissors can work in a pinch,
Okay.
but trauma shears are designed for those high-pressure situations.
Okay.
They're sturdy.
Mm-hmm.
They have a blunt tip to prevent accidental punctures.
Okay.
And they're often able to cut through thicker materials
Right.
like seat belts or heavy denim.
Okay, I'm convinced trauma shears are a must-have.
Good.
What else should we include?
Small scissors are helpful for a variety of tasks,
Okay.
like cutting tape or trimming bandages.
Right.
And don't discount the power of safety pins.
I never thought of safety pins as a medical supply.
They are.
Okay.
You'd be amazed at how useful they are in a pinch.
I bet.
Yeah, and let's not forget about those often overlooked examination tools. Tweezers for removing splinters,
Mm-hmm.
a magnifying glass for closer inspection of wounds,
Right.
and a penlight for checking pupils.
Okay, wow. Level 2 is turning out to be just as comprehensive as level 1.
It is.
It's all about those everyday injuries and having the right tools to handle them effectively.
Yeah.
Awesome.
Okay. Welcome back. We're deep in the trenches of building the ultimate emergency medical kit, and we've laid a solid foundation with our level 1 and level 2 essentials.
It's incredible how many important details there are, even just for like those everyday injuries.
Yeah.
Now, where were we? Yes, delving deeper into level 2.
Exactly. We were about to explore those all-important medications
Right.
and how to equip your kit to handle a wider range of common medical situations.
Okay, so beyond basic wound care, what else should we be thinking about?
Pain management is crucial.
Okay.
Whether it's a sprained ankle, a throbbing headache, even muscle soreness after an intense workout,
Yeah.
having a variety of pain relief options in your kit can make a world of difference.
All right, so what kind of pain relief superstars should we be stocking up on?
Let's start with the classics.
Go.
Acetaminophen, Tylenol, ibuprofen, Advil, and aspirin.
Okay.
These are the workhorses of pain relief, each with its own strengths and uses.
Okay.
Acetaminophen is generally good for fever and mild to moderate pain,
Okay.
while ibuprofen is more effective for inflammation and menstrual cramps.
So.
Aspirin, on the other hand, is also effective for pain and inflammation.
Right.
But it's important to note that it should not be given to children.
That's a good reminder about aspirin in children. Yeah, it's always best to err on the side of caution there.
Definitely.
Now, what about those topical treatments? Sometimes a targeted approach can work wonders.
Absolutely. Topical pain relievers can be incredibly effective for localized pain.
Yeah.
For example, lidocaine cream can help numb pain from burns, insect bites, and skin irritations.
Okay.
It can also be helpful for those painful blisters you might get after a long hike or run.
And what about those good old-fashioned ice or heat packs?
Right.
They seem to be a staple in any medical kit.
They are, and for good reason.
Okay.
Cold therapy with ice packs can help reduce swelling and inflammation, especially in the first 24 to 48 hours after an injury. Heat therapy, on the other hand, can help relax muscles,
Okay.
relieve stiffness, and promote blood flow to the area.
So a good mix of ice packs and heat packs is a must.
It is.
Okay. I have to confess, I always have a tube of muscle rub in my kit.
Smart.
It's just my go-to for those post-workout aches and pains.
That's a smart move.
Yeah.
Remember, a well-stocked medical kit isn't just for major emergencies.
Right.
It's a valuable resource for everyday health and wellness, too.
Good point.
Yeah.
Now, shifting gears a bit, allergies and respiratory issues can be quite serious, especially in an emergency where access to medical care might be delayed.
Right.
What should we be packing in our kits to address those concerns?
You're absolutely right. Allergies and respiratory issues can quickly escalate.
Yeah.
So being prepared is key. Antihistamines are essential for managing allergic reactions.
Okay.
And there are two main types to consider.
Okay.
First-generation antihistamines like diphenhydramine, Benadryl, and second-generation antihistamines like loratadine, Claritin.
So two types of antihistamines.
Yes.
Is there a difference in how they work or when you would use one versus the other?
Yes. So first-generation antihistamines like Benadryl work quickly but can cause drowsiness.
Okay.
They're great for those sudden, severe allergic reactions where you need immediate relief.
Okay.
Second-generation antihistamines like Claritin are less likely to cause drowsiness.
Right.
And are often preferred for longer-term allergy control.
Okay, that's helpful. So Benadryl for those emergency situations.
Yep.
Claritin for everyday allergy management.
Exactly.
Okay, got it. What about asthma?
If you or someone in your family has asthma, an inhaler is an absolute must-have.
Right.
It's important to keep a spare inhaler in your kit, especially if you're traveling or engaging in activities that might trigger an asthma attack.
Right, and I'm guessing an epinephrine auto-injector like an EpiPen is crucial for anyone with severe allergies.
Absolutely.
Those can be life-saving in anaphylactic reactions.
They can, and anaphylaxis is a severe, potentially life-threatening allergic reaction that can happen quickly.
Right.
And an EpiPen can buy you precious time while you seek medical attention.
Yeah.
It's important to have these readily accessible and to know how to use them correctly.
Okay, so allergies and respiratory support. Check. Now let's talk about the less glamorous, but equally important issue of gastrointestinal distress.
Okay.
I mean, in a stressful situation, anything can happen.
You're not wrong.
Yeah.
And let's be honest, even in non-emergency situations, digestive issues can be incredibly uncomfortable and debilitating.
Oh, yeah.
Having the right supplies in your kit can make a world of difference.
So what kind of GI heroes should we be adding to our arsenal?
Antidiarrheal medication is a must-have.
Okay.
Loperamide, Imodium, and bismuth subsalicylate, Pepto-Bismol, are two common options. They work in different ways, so it's good to have both on hand.
Okay.
Loperamide slows down bowel movements, while Pepto-Bismol coats and protects the stomach lining, reducing inflammation and absorbing toxins.
So two different approaches to combating diarrhea.
Yeah.
What about the situations where vomiting is the main issue?
Anti-nausea medication can be a lifesaver in those situations.
Okay.
Dimenhydrinate, Dramamine, and ondansetron, Zofran, are two common options.
Okay.
Dramamine is often used for motion sickness, but it can also help with nausea and vomiting from other causes.
Right.
Zofran is a more powerful anti-nausea medication that's often prescribed for chemotherapy-induced nausea and vomiting.
Right.
But it can also be helpful for other types of nausea.
That's good to know. So we've got antidiarrheal meds and anti-nausea meds covered. But what about rehydration? Isn't that important too?
Absolutely.
Yeah, especially if you're dealing with vomiting or diarrhea.
Dehydration can be a serious complication of gastrointestinal distress, especially in children and older adults. Oral rehydration salts or electrolyte powder can help replenish fluids and electrolytes lost through vomiting and diarrhea.
Yeah.
They're also a good idea to have on hand for hot weather or strenuous activity where you might be sweating excessively.
Okay, so we've got pain relief allergy meds, respiratory support, gastrointestinal relief, and rehydration. That's a lot to remember. Is there anything else we need to consider for our level 2 medication stash?
This is where it gets a bit more personalized.
Okay.
If you or anyone in your family takes regular prescription medications, it's crucial to talk to your healthcare provider about including an emergency supply in your kit.
Yeah.
This is especially important for essential medications like insulin heart medications or seizure medications.
That's a great reminder. It's easy to focus on the over-the-counter stuff.
Right.
But those prescription medications can be life-sustaining.
Exactly. And remember, a medical kit is only as good as its weakest link.
Right.
If it's missing crucial elements, its overall effectiveness is compromised.
So true. All right, now I'm ready to tackle level 3. That realm of extended care scenarios where we might need to manage more complex situations for a longer period.
Level 3 is where we step into a more specialized realm.
Okay.
And the supplies we choose can significantly impact our ability to handle those unexpected challenges.
I'm ready to level up. Let's dive in.
All right.
Okay, we are back and ready to conquer the final frontier of our emergency medical kit deep dive. Level 3. The realm of extended care.
All right.
We've covered a lot of ground already, from those immediate life-saving interventions
We have.
to those everyday bumps and bruises.
Yeah. And now we're venturing into a territory where preparedness goes beyond simply treating injuries.
Okay.
It's about having the knowledge and resources to manage more complex situations.
Right.
Potentially for an extended period when access to medical care might be limited.
So level 3 is all about resilience and self-sufficiency.
Yes.
In those unpredictable scenarios.
Exactly. It's about bridging the gap and having the confidence to handle whatever comes your way.
I like it.
And a key aspect of that preparedness
is understanding the role of diagnostic equipment.
Diagnostic equipment? That sounds a little intense.
It does.
Are we talking about like setting up a mini hospital in our homes?
Not quite.
Okay.
But having a few basic diagnostic tools in your kit can give you valuable insights to a person's condition.
Okay.
Helping you make more informed decisions about the level of care that's needed.
Okay. So instead of just guessing, we can actually get some concrete data.
Exactly.
I'm intrigued. What kind of tools are we talking about?
A blood pressure cuff is a great place to start.
Okay.
It allows you to monitor blood pressure, which can be an important indicator of shock dehydration or other underlying medical conditions.
So if someone's blood pressure is like a bit abnormally low, that could be a sign that something more serious is going on.
Exactly. It's a vital piece of information that can help you determine the urgency of the situation.
Okay.
And a stethoscope can further enhance your assessment skills.
Right.
It allows you to listen to heart and lung sounds,
providing clues about respiratory distress, heart rhythm abnormalities, or even a collapsed lung.
Wow, I'm starting to feel like a medical detective here.
A little bit.
What about a pulse oximeter? I've seen those used in hospitals. They measure the oxygen levels in your blood, right?
You are right on the mark.
Okay.
A pulse oximeter is a small portable device that clips onto your fingertip and measures the percentage of oxygen saturation in your blood. This is particularly crucial in situations like respiratory illnesses or altitude sickness, where oxygen levels can be compromised.
That makes sense.
Okay.
Okay, so blood pressure cuff, stethoscope, and pulse oximeter.
Yep.
Those are our core diagnostic tools.
Our core tools.
Are there any other specialized tools that we might consider for level 3?
Depending on your needs and interests,
okay,
you might want to include a glucose meter for checking blood sugar levels.
Okay.
This is especially important for individuals with diabetes
right.
or those managing hypoglycemia.
Okay.
A thermometer is another essential tool, allowing you to accurately assess body temperature and monitor for fever.
And I've always been fascinated by those otoscopes that doctors use to look inside your ears.
Yeah.
Could those be helpful in a level 3 kit?
An otoscope can be a valuable addition, especially if you have young children who are prone to ear infections.
Right.
It allows you to visualize the eardrum and look for signs of infection, inflammation, or fluid buildup.
Okay. All right. So we've equipped our level 3 kit with a mini doctor's office worth of diagnostic tools.
We have.
What about surgical supplies? I'll admit that's a bit intimidating.
I understand.
Yeah.
Surgical supplies are definitely more specialized.
Okay.
And we always recommend seeking proper training before attempting any procedures.
Of course, right.
But for those with the knowledge and the skills, having a basic surgical kit in your level 3 arsenal can be incredibly valuable.
So we're talking about situations where medical help might be delayed or unavailable.
Yeah.
And you need to take more advanced action.
Exactly. A suture kit, for example, can be used to close wounds that are too deep or wide for butterfly closures.
Okay.
Surgical gloves are crucial for maintaining sterility and protecting both you and the person you're treating.
Yeah.
And scalpel, while intimidating to some, can be essential for removing foreign objects, draining abscesses, or performing other procedures that require precision.
Full disclosure, I'm not planning on performing any DIY surgeries anytime soon.
That's probably wise.
But I can see how these supplies would be invaluable for someone with the proper training.
Absolutely. And remember, knowledge is power.
Right.
Even if you don't have formal medical training.
Yeah.
There are courses available that can teach you basic wound care and suturing techniques.
Yeah.
Having that knowledge can give you the confidence to act effectively in those challenging situations.
That's a great point. What about sterile supplies?
Okay.
I'm guessing those are crucial for any kind of surgical procedure?
Yes.
Or advanced wound care?
You're absolutely right. Sterile supplies are essential for maintaining a clean field and preventing infection.
Okay.
Irrigation syringes are a must-have for flushing out wounds with sterile water or saline solution, removing debris and promoting healing.
Okay.
Sterile gauze and surgical sponges are used to absorb fluids, protect wounds, and maintain a clean environment.
So we're taking wound care to a whole new level here.
We are.
It's not just about slapping on a bandage anymore.
Nope.
It's about creating a sterile environment and using specialized tools and techniques to promote healing.
Exactly. And remember, even in those non-surgical situations, sterile supplies are essential for preventing infection.
Right.
For example, if you need to irrigate an eye after a chemical splash, you'll want to use a sterile irrigation syringe and solution.
Okay, sterile supplies.
Check.
Check. Now, what about those personal protective measures?
Okay.
I'm guessing those are crucial for anyone providing medical care?
Right.
Especially in those extended care scenarios?
You're spot on. Personal protective equipment, or PPE,
Yeah.
is essential for protecting both yourself and the person that you're treating.
Okay.
Nitrile gloves are a must-have for preventing the spread of infection through contact with blood or bodily fluids.
Right.
N95 masks are crucial for filtering out airborne particles,
Yeah.
protecting you from respiratory droplets that can carry viruses and bacteria.
Right.
And eye protection, such as goggles or face shields, is essential for preventing splashes of blood vomit or other potentially infectious materials from entering your eyes.
Okay, so PPE is all about creating a barrier and minimizing the risk of exposure.
It is.
What about cleaning and disinfecting? How do we keep our level 3 kit and our surroundings as clean as possible?
Hand sanitizer is your best friend in these situations.
Okay.
It's a quick and easy way to disinfect your hands when soap and water aren't available.
Okay.
Antiseptic wipes are also handy for cleaning surfaces and tools before and after use.
Right.
And biohazard bags are essential for safely disposing of contaminated materials, preventing the spread of infection.
All right, level 3 is definitely the most complex level in this medical kit game.
It is.
But I'm starting to see how all these pieces fit together to create a truly comprehensive resource for those extended care scenarios.
Exactly. And remember, building a level 3 kit is a personalized process.
Right.
It's about assessing your skills, your knowledge, and the potential scenarios you might face.
Okay.
And tailoring your kit to meet those specific needs.
So while those levels provide a framework, our individual needs and circumstances should really guide our choices when it comes to those level 3 supplies.
Absolutely. And that brings us to the end of our deep dive.
Wow. I feel like we've covered so much.
We have. It's been a journey.
It has.
But hopefully you feel empowered to build a medical kit.
Absolutely.
That you can truly rely on.
I feel like I could tackle anything now.
That's the goal.
It is.
Remember, it's not just about having the supplies. It's about knowing how to use them.
Yes.
And having the confidence to act.
100%. So, to our listeners out there, what's the first step you're going to take to build or update your emergency medical kit?
Yeah, let us know.
Share your progress with us on social media. We'd love to hear from you.
We would love to.
And remember, being prepared isn't about living in fear. It's about having the confidence to face whatever comes your way.
Couldn't have said it better myself.